Hi and welcome back to my channel. I hope you're all doing well today. I hope you're all having a great Tuesday. And today I thought I would talk about hand therapy and how they can support autistic people to attend their medical appointments. So first of all, I thought I'd start off reading the hand therapy definition. So what is hand therapy? Hand therapy is a treatment if you are recovering after a wrist operation or hand surgery, as our hands give us the ability to grasp, hold and move and manipulate objects, as the hands consist of the wrist, the palm, the fingers and are vital for everyday functioning. So what is a hand therapist? A hand therapist is a highly trained occupational therapist treating in wrist and hand conditions. They aim to give you a treatment or care plan after you've recovered from having an operation. So basically, as people like myself who have recently recovered from having an operation, which was a carpal tunnel decompression surgery, I've had both my left and my right hand done now. So hopefully I won't have no more trouble with my wrists or my hands. But I want to discuss, as an autistic person, how they can work together with you to help support you whilst you're attending a hand physiotherapist, hand therapist clinical appointment within the hospital, local doctor's surgery, GP surgery, community supported housing if you're living in that kind of situation, homeless unit, etc. So I'm going to see a hand therapist on Friday to help me manipulate and move my hand and get my hand recovered after having recent carpal tunnel decompression surgery, which by the way went successfully well. So here is some advice as an autistic woman, autistic perspective I have for both the hand therapist and occupational therapist and hand physiotherapist. So first of all, I would like you to do is introduce yourself, show your name badge and your job title, explain what your job title is, to keep our appointments on time, explain what is going to happen during the appointment, explain the treatment plan or exercises that are going to be needed for full recovery, give sensory processing time for us to understand the information you may give to us or you may show us during our appointment time, give us breaks during an appointment if we need, so if we get sensory overwhelmed, anxious and we need some breaks, give us time to stop and then start again for the appointment. If possible, to dim the lighting down, because I know a lot of places like the NHS, GP surgeries, etc. do have quite bright lights. Like my light up above me is quite bright, but again, if you do have something like a dimmer or a switch where you can switch it down a little bit or switch the light off, it may be beneficial for the autistic person to feel more cooperative with you and also to be more functioning and be able to cooperate with you and the treatment process. So that may be another thing, also to lower their anxieties or sensory overloads or depression. So they may feel a bit depressed, anxious, stressed out about attending a medical appointment on their own. Some autistic people aren't as verbal as what I am, so they may be more heightened and on a sensory alert than I am. Also, have all the information that you're going to tell us or show us in an accessible format. Again, many autistic people get overwhelmed with the amount of information that you're giving to us. We may get shut down, we may not process all the information at one time. So again, make sure the information that you are giving to us or well may need to give to us towards the end of the appointment session. Give it to us in a format that's going to be either easy read or bullet points or shorten information, because again, we do get quite overwhelmed with the amount of information put into our heads. So again, take that into consideration. If we do need further appointment times, this is another big thing I am going to stress, which I know might happen to me. Please make sure, if we are needing to have further follow-ups or further sessions of hand therapy or hand physio, make sure we can have the same hand therapist, because again, that will build up the rapport, the trust. It will reduce anxiety, reduce sensory overloads, reduce the episodes of depression or sensory overload or anxiety panic attacks, because a lot of autistic people will get overstimulated within a clinical hospital environment. They may need to come with a carer or parent. So again, please do not expect all autistic people like myself to be able to attend a medical appointment by themselves. They may need a professional support. They may need a carer, a friend, a family member to attend the medical appointment with them to help support them and be their moral support in case they end up having a meltdown or a shutdown or anxiety or a panic attack. Because again, you have to remember, in a medical institution there is a lot of machines, there is a lot of noise, there's the smell, there's the touch, there's the sensations of being touched, there's the perfume or cologne on your work uniform. You may be wearing perfumes that are high pitched, so again, the high scent smell may take us into sensory overwhelm, sensory shutdown, burnout if you're not too careful. But yeah, these are just some things that I thought that I would cover. And I know that each hand therapist and occupational therapist is trained differently. I know that it may be not applicable to some autistic people, that they may not need these sensory adjustments or reasonable adjustments whilst they're attending a clinical, hospital, GP appointment, community appointment, depending on whether the hand therapist or occupational therapist works. But I just want to talk about this from an autistic perspective, because as someone who is highly sensitive, highly anxious, highly agitated, I'm just wanting to make the hand therapist and occupational therapist know, please give me time to communicate. Don't assume that I'm going to be okay with everything when you get to meet me, because, again, another thing I'm going to mention that I haven't mentioned right now, I should have put to the beginning, is please don't go to shake hands with autistic people, because when you go to greet them and you go, nice to meet you, and put out your hand, they might think, why are you doing that? So just make sure that you're able to communicate with them clearly, slowly, and take their autism into account. And usually it would be flagged on their medical records, but if not, some autistic people may have autism alert cards. So I carry a autism alert card in my wallet. It's with me 24/7, so if something happens to me, you're able to successfully communicate with me. So make sure you ask about that, and any hobbies, interests that make the discussion easier during treatment. So I hope you've enjoyed learning my autistic perspective on this video. Please like, comment, share, and subscribe. I'll be back next time. Bye!